Where does lead poisoning come from? The Environmental Protection Agency states that it comes from everyday things that contain lead, such as dust, soil, water, dishes, or jobs or hobbies. Paint made before 1978, as it ages, may begin to peel into chips and dust that can gather on surfaces that we touch every day or on objects that children may put into their mouths. Soil may be contaminated from gasoline when it still contains lead, from certain industries that still use lead, or by peeling lead-based paint on the outside of a structure. Water may be contaminated by old pipes that contain lead. Dishes may contain lead in the glaze. Jobs and hobbies may bring us into contact with lead through lead smelters, working on cars, refinishing furniture, or working with stained glass. Lead poisoning sounds scary, but there are a few simple steps to take to help protect our families. Who is at the greatest risk? According to WebMD, children under the age of 6 are at the greatest risk because they play close to the ground where it is easy to breathe in lead-contaminated dust. Babies and toddlers are easily affected because of their small body size, because their brains and bodies are growing and developing rapidly, and they like to touch and taste everything. They're exposed to lead by swallowing, breathing, or touching lead-contaminated substances. Lead is slowly eliminated from the body in urine, bowel movements, and a little through sweat. When our body is exposed to more lead than it can get rid of, it stores the extra in the blood, organs, bones, and teeth. This results in lead poisoning. In children, this can cause decreased intelligence, learning disabilities, nervous system, and kidney damage. General symptoms of lead poisoning appear when lead levels are high. Symptoms in children may include headaches, stomach aches, or they may become irritable and tired. Treatment for lead poisoning begins with professionally removing the sources of lead and providing balanced nutrition. Through a simple blood test, a doctor can determine blood levels and the need for drug therapy of chelating agents. Chelating agents cause metals like lead to bind to them, and this makes it easy to eliminate them from the body through urine. How can we prevent lead poisoning? According to the EPA, if your home was built before 1978, you may call 1-800-424-LEAD for a list of contacts in your area that can test for lead. If you have peeling or chipping paint, have it tested for lead and professionally removed. Cover dirt with mulch or plants to keep children away from outside walls that may be painted with lead-based paint. Call your local health department to have your soil tested. Let cold water run for a minute or two before using it to cook with or to drink. Call your local water supplier to have your water tested. Make sure your dishes are lead-free. Always wash your hands before eating and maintain a healthy diet. Keep toys, pacifiers, floors, and windowsills clean. If you're exposed to lead at work and are not able to leave the clothes you worked in there, remember to remove your shoes before entering your house and wash your work clothes separately. Children under the age of 6 should be tested yearly. Remember that with a few simple steps, we can protect our families.